Welcome Gold participants from near and far. I'm Fleur Bickford, Program Director and MC of Gold Midwifery 2015. I'm here today talking with Karen Strange about her upcoming presentation titled Neonatal Transitional Physiology, Delayed Cord Clamping Demystified. Welcome, Karen.
Thank you. Nice to be here.
So, first question I have for you is, I know that you are teaching resuscitation classes, but I also know that your classes are different from standard neonatal resuscitation classes. So I was hoping you could tell us a little bit about how your classes are different.
Oh, for sure. Thank you. So I'd love to do that. So one of the main things that my classes are different is, well, when I first started teaching, I kind of noticed how much fear there was around resuscitating newborns, and I really wanted to teach how to resuscitate babies in a way that worked and in a way that helped people be a little more settled in the process. And so as I learned more about what the transition that babies make at birth, I started including it in my class. So I cover this neonatal transitional physiology, which is the physiology of what happens as the baby is being born, when it goes from being in its mother to becoming an air breather. Another piece to help people understand the process was to talk a little bit more about the baby's experience and the baby's perspective of what happens. So I just started embedding that into the lecture as well. And my big goal was for people to know what to do, even if they forgot the numbers. There seems to be so much focus on the numbers, which actually is very fear-provoking. And my goal is I wanted people to, even if they forgot the numbers, know what needs to happen for a baby in respiratory distress or a non-breathing baby. And so that's what's embedded in the class, plus a little bit more than that.
Thank you for that. It sounds fascinating, and I certainly agree with you. There is, a lot of fear, and it's often, obviously if we have a baby who's not breathing, it's a very panicked situation. So I love your approach. It sounds really fascinating. So the next question I have is, what is the big shift that babies go through that allows them to go from being in a fluid-filled environment in the womb to breathing air?
Well, it's a pretty simple understanding, and I love explaining this. So babies in utero aren't breathing, right, with their lungs. They don't use their lungs while they're in utero. They're getting all of their oxygen and nutrients through the placenta and the cord and the blood exchanging. And so when babies come out, they actually have to become air breathers. And in utero, their lungs are fluid filled. Right, so they're not using their lungs, and then when they come out, this fluid has to clear so that they begin breathing with their lungs, and the whole process of birth is really meant to support clearing the fetal lung fluid so that the baby can become an air breather and use their lungs just like you and I breathe. So that's really there's a little bit more to it than that, but that pretty much covers. Babies go from fluid-filled lungs to air-filled lungs, and it happens usually without anybody having to do anything, but occasionally, for whatever reason, there's a little glitch, and sometimes babies need a little bit of help, and I teach them how to give them that help.
Wonderful, thank you. And it sounds so interesting, and I love your approach to all of this, and your passion is very obvious when you're talking, which is wonderful. So, final question for you. What is the main thing that you hope people take away from your presentation?
Well, my main thing, my main hope is that they understand that this blood that is going from the placenta into the baby at birth is that it's the baby's blood. The blood in the placenta and the cord and the baby is all part of the baby's blood, and it's our job to ensure that the baby gets all of their blood, because you need a full blood volume for all of your organs to work, for your brain to begin perfusing, the heart to start beating. This is really critical. You need a certain volume of blood for circulation to occur, and to always remember it's the baby's blood. It's belongs to the baby. And so our job is to do what it takes to make sure the baby gets its full blood volume. And I try to make that pretty clear and easy to understand, and giving resources for how you can become more educated regardless of where the baby's born, so that you can really advocate for leaving the cord intact to allow the baby to get its full blood volume.
Wonderful. Thank you so much. I really appreciate you taking the time to talk to us today about your presentation.
Thank you.
So for our delegates who are listening, Karen will be presenting live on February 23rd at 1700 UTC. So we look forward to seeing you then.
Thank you. Looking forward to seeing you all then.